In 1945, CARE International made one such decision, bringing a positive change in people's lives, and we haven't looked back since. This journey brought us to Pakistan in 2005. And since then, CARE International Pakistan has inspired human innovation in promoting gender equality and women empowerment. As a leading global development and humanitarian organization, CARE International works with local implementing partners, civil society, local communities, private sector, academia, and the government, with the aim of reducing poverty by focusing on women empowerment and gender equality. Our core approach is gender and governance, and in this model, our partnership with the government is a significant pillar in creating a lasting change in people's lives.
Everyone knows CARE Global's mission is gender empowerment, and that goes for CARE International in Pakistan. We believe that if you empower women, the household is going to be in a stronger place. Children will go to school. Children will get the health service they deserve. However, we cannot do it without the man. That's why we're not saying women empowerment, but gender empowerment. We need to do it as a team. Our main objective, of course, is to alleviate poverty for 28 million women. Of course, that's a high number, but with our innovative ideas, a smart team and fantastic partners with the government, with the local NGOs, civil society, we're confident that we're going to achieve that. I am so impressed with this team. We've got one international and it's me. I cannot do it without having the best people in the organisation, and I can say CARE Pakistan has some of the best skills I've ever worked with, and I've worked in many countries.
CARE believes in the holistic model of education, from building the foundations of literacy to equipping them with skills for livelihood. We have worked towards overcoming discriminatory attitudes and practices towards girls' and women's education and improve the quality and standards of education service delivery. Through various projects in Khyber Pakhtunkhwa, CARE has been able to provide infrastructure to disaster-affected areas for primary schools, improved transition of girls from primary to secondary education, promote effective teaching and learning skills, and lastly, work with government towards advocating for improving access to girls' education. Directly impacted 33,746 individuals and affected the larger community as well in changing attitudes and promoting education initiatives.
हमारे स्कूल में इतने सारे काम थे, ग्राउंड था स्कूल का, वो चलने के काबिल नहीं था। केयर और आइडिया ने उधर काम करना शुरू कर दिया, रेनोवेशन का। मेरे बच्चे जो बिल्कुल फर्श पे बैठते थे, तो उन बच्चियों को उन लोगों ने कारपेट पे बिठाया।
In the health sector, CARE has worked in different regions of Pakistan to complement health system strengthening through capacity building of healthcare providers, refurbishment of public healthcare facilities, and supply of emergency medical equipments and medicines, and also created community awareness regarding family planning, improved maternal reproductive healthcare, and PAC services. CARE has directly touched the lives of 47,642 women and indirectly benefited 1,754,109 individuals.
CARE International के साथ जो ये प्रोग्राम चल रहा था, उन्होंने आके यहाँ इनको ट्रेनिंग दी है। फिर इससे एक सबसे बड़ा फ़ायदा ये हुआ कि जो पब्लिक, जो लोगों की जो कोऑर्डिनेशन है ना, वो बढ़ी अस्पताल के साथ।
CARE Pakistan has worked in Sindh and Punjab to change the lives of rural women and girls by giving them a means of supporting themselves financially. Through its programs, CARE aims at changing the power dynamics for women's social existence and their interactions with their society by promoting well-informed decision-making and teaching them innovative approaches and methodologies to access services, promote entrepreneurship, and create linkages within the community. Women economic empowerment for CARE Pakistan also revolves around developing socially responsible business models, which employ innovation across a variety of sectors. In order to create impact with scale, our experience has shown the importance of forging partnerships, especially with the private sector. It is possible to economically empower women and girls by engaging marginalized communities existing at the bottom of the pyramid, whilst leveraging huge business opportunities at the same time. With CARE's intervention, 8,525 women have been directly impacted. 533,425 indirect beneficiaries have been positively affected, most of which are women.
पहले कच्ची रस्तियों का काम हमें दिया था तकलीफ फाउंडेशन और केयर वालों ने, तो उसकी माहाना पगार जो थी 4,500 थी। फिर उन्होंने जो हमें ये कारोबार दिया, गांव वाले यही कहते थे कि जो मर्दों का काम है औरतें कर रही है, ताने वगैरह सुनने पड़े। और अब हमारा अल्लाह का शुक्र है, हमारे बच्चे, हमारा रोजगार जो अच्छा चल रहा है।
Emergency preparedness and disaster risk reduction are an integral part of CARE's humanitarian work in Pakistan. Since 2005, CARE has provided $80 million for emergency relief and recovery support to over 1.8 million people across Pakistan through health, shelter NFIs, food security and livelihood, and WASH interventions. CARE has prepared communities for disaster by creating resilience and delivering timely humanitarian assistance, as well as reducing vulnerability for individuals in crisis-affected areas, especially women and children. CARE has also worked towards strengthening partnerships with local civil society for effective and responsive humanitarian governance. Through joining hands with PDMA, CARE has developed a 5-year roadmap for PDMA Khyber Pakhtunkhwa, which is being replicated by other organizations.
Zamang saradi NGO wala mung leda blastani tulane au didi poja mane mung ta dir intiyahi sahulat milaw shwe da dir शुक्रगुजार यहाँ वो zamang da sar sura निश्ते mung da sar sura bakar da ची मतलब da mung ta shelter milter avda होली
To live its vision, CARE promotes a continuum of change through advocacy, promoting core values of gender equality and minimizing poverty through innovation.
CARE's partnership model believes that CARE has to work with the local civil society organizations in Pakistan to deliver the development agenda. This belief is grounded in the fact that the local partners have the legitimacy and they have the knowledge and they have a relationship with the beneficiaries and the impact group on the ground. And CARE as an international organization has the global experience and wisdom and knowledge to help them build their institutional capacity. This is the summary for CARE's partnership model.
We believe that through consistency of effort, innovative solutions, and an unshakable belief, we can achieve our goal of bringing 28 million marginalized women in Pakistan out of poverty by 2026. Because only then can we realize our dream of seeing a prosperous and empowered Pakistan.